All right. I hope everybody has had a good day, and we have Jay Singh with us today. We're going to run a few scenarios. Jay, you ready?
Yes, I'm ready.
Okay. So we have this 29-year-old woman who's referred to you by a GI colleague for evaluation of Crohn's. You are seeing her as she's an inpatient in the hospital. She has no prior surgical history and is being treated medically for the last 1 year for terminal ileal Crohn's disease. She has been on Humira and azathioprine with minimal improvement. She was started 6 days ago on 30 milligrams of prednisone. 2 days ago, she was admitted to the hospital with nausea, vomiting, and abdominal pain. She was then started on high dose IV steroids, and she's had two prior such admissions before. Last colonoscopy, which was done about 2 months ago, had shown a distorted ileocecal valve, and the GI could not intubate into the terminal ileum. On physical examination, she's got a temperature of 100.5, pulse of 105, blood pressure of 115 by 70. She's thin, appears malnutritioned. Abdominal examination with mild tenderness in the midline and towards the right of the lower abdomen. No peritonitis. Otherwise, no changes in the perineal area. Her laboratory examination, which has already been done, showed a hemoglobin of 7.9, WBC count of 13.3, albumin of 2.1, and a CRP of 97. What do you think is going on, and what would be your differential?
My differential is so she has Crohn's disease, and she has an acute exacerbation of her Crohn's um, ileitis, which is also causing obstruction. It could be so she, yeah. So that's what's going on with her, I think.
Okay. Anything else? They said,
She
what
she
are
because she also has a low grade fever, and the white count, there is a possibility of abscess as well.
okay. Anything else that you want to rule out, or you may think might be going on?
Perforation, she may be having perforation.
Okay. Okay. Anything else?
No, I would go and examine her, and uh, um, and I would also like to do a I don't know if she had any imaging. If not, then um, I like to do a CT scan of abdomen and pelvis.
What would you like to order for your CT scan?
Um, well, I think I would do CT enterography uh, to have a better idea assessment of the her Crohn's disease, as well as to look for the obstruction, the uh, transition point, as well as free air or abscess.
So, because she's an inpatient, they say, and the way she is acutely presenting, they are unable to do a CTE for you. But they say anything else you would want us to order?
They are inpatient, they're not able. Okay, we can, if they are able to do it, then we'll do a small bowel follow through.
They suggest they can do a CT scan with IV contrast. Will that be okay? And
uh,
centrifugal contrast?
I would like the CT angiography, but if not, then yes, I would do a CT scan, looking at her creatinine, making sure her creatinine is.
Oh, this is what it shows, the CT scan with IV contrast. What are you looking at?
So I'm looking at distended stomach.
Yes.
Uh, I see the small bowel, the terminal ileum, which look a little thick wall, thick wall. The wall are thick and edematous, and a small caliber. So it looks like that she has a stricture in there. The proximal bowel is also slightly dilated, not significantly dilated, but they are little dilated bowel lobes. But I can clearly see the stricture of the terminal ileum.
Okay. Good. So over the next 2 days, her pain is getting worse, and she's got some mild localized peritonitis now in the right low quadrant. What's your plan?
So in the meantime, what I'll do is I like to put an nasogastric tube for the decompression and start her on. She's already getting high dose steroid. I'll also add some antibiotics just because she has a low grade fever and the white count. But if her pain is not getting better and she's not getting better, then I would.
So after evaluation of 24 hours, you find that she's actually a little more tender what she was the day before.